Hello, everyone. My name is AlexisS, and today I will be talking about fetal alcohol syndrome. So, this can affect any newborn that has had exposure to alcohol as a fetus. It doesn't have a preference for race, age, or gender, socioeconomic status. Anyone who has had a fetus that has been exposed to alcohol can have fetal alcohol syndrome. So, it is recommended to avoid all drugs and alcohol during pregnancy up to 3 months before being pregnant. This way, it's just an entire preventable disease. It doesn't have to be something that is random or genetic. It's simply due to exposure to alcohol as a fetus in the womb. So, this is not limited to illegal drugs. I think a lot of people think when they hear fetal alcohol syndrome that it can be related to illegal drugs or really high content in alcohol. And this is just not the case. It can be as simple as cough syrup. It can be as simple as something that's very over the counter medication. It should still be avoided. And as many as 1.5 out of every 1,000 live births in the United States have been diagnosed with fetal alcohol syndrome, and 1 in 20 children may have been exposed. And it is entirely preventable. So, what that can look like is a low birth rate, problems with the heart, damage to the brain, the weight of the fetus can be low, and these can be really hard to look at because fetal alcohol syndrome is such a wide umbrella that it can be difficult to diagnose because it can present as so many different things. That includes a learning disability, hyperactivity, problems with social communication, really poor judgment skills, difficulty with attention. It can present as like ADHD, and the reality of it is that these things are all can be related back to fetal alcohol syndrome. As far as long-term issues go, one's mental health can be really affected. It can cause anxiety, depression, bipolar disorder. Keeping a job can be very difficult with attention span and long-term goals. Living alone can also be something that's difficult. Maintaining that self like self-preservation can be really, really difficult. Social skills can be another thing, getting an interview, having friendships. These can all be presented as really, really difficult for someone who has fetal alcohol syndrome. This can also present as trouble with the law or really poor social skills and risk-taking behaviors. So these things can all really look like fetal alcohol syndrome and can be diagnosed as fetal alcohol syndrome. So while there's no cure, you can go to a pediatrician, a primary care provider, physical therapist, neurologist. All these professionals can help in intervention for fetal alcohol syndrome, and it can start as low as 6 or below. It needs to be monitored and it needs to be addressed. Children with fetal alcohol syndrome immediately need to be addressed so they can start building on behaviors that are seen as socially acceptable and can give them an upper leg on understanding what they're diagnosed with. So there can be minor issues with facial features. There can be attention difficulty. A birth defect with alcohol exposure can look like a really big difficulty in bone structure or hearing. And then follow-up and certain techniques is vital for someone who has fetal alcohol syndrome. And so this can really look like doing screening with doctors for prenatal alcohol exposures, being honest in your pregnancy if you have had any alcohol or over-the-counter drugs. The treatment plans are really based off what the individual is presenting as. It's important to think about like the protective factors for someone who has fetal alcohol syndrome. So this can look like getting a referral really early, having a stable home environment, no violence, and being really involved in the services in one's area. And routine is necessary. There is no like medications that are specific to this disorder. A lot of that can just look like certain stimulants or certain antidepressants. That can be a transition for those intervention programs, and they really can vary on any types of strength. It's really vital to understand that this is something that is individual based and every single person could look different, which makes it much more difficult to diagnose and treat. It can also just look like mental health and therapy and group work, or it can look like in the school, like reaching out to those sources, getting the extra tutoring they need, and building on those behaviors of asking for help. And I just hope that y'all learned a lot today. And if you have any questions, please leave a comment. Yeah.